Pet Life Radio.
This is Pet Life Radio. Let's talk pets.
Is your pet stressed out? Does your pet need annual vaccines? Which pet is best for a child? Would you know if your dog was in pain? Pet Life Radio presents The Pet Doctor, where you'll learn everything about keeping your pet healthy and happy. From pet care, pet meds and grooming, to pet food, pet insurance, and dental care, this is the place to find out everything there is to know about pet wellness. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets, because it's your pet. Health matters. Please welcome your Pet Doctor host, veterinary media consultant and veterinarian, Dr. Bernadine Cruz.
According to nationwide pet insurance claims data, the most common reason why dogs were taken to veterinarians in 2019 was for allergic dermatitis, itchy skin, with ear infections coming in a very close second. In reality, if we investigated these cases, the allergic skin problems likely led to many of the ear issues. But why do dogs get these pesky, painful, and pricey problems? And why do they seem to keep coming back? What can you do at home to decrease the likelihood that your dog will be affected? My guest is Dr. Darren Berger. He is a board-certified veterinary dermatologist and Associate Professor of Dermatology at Iowa State University's College of Veterinary Medicine in Ames, Iowa. We're going to be right back after this short break.
So now I've got this pack of 4 Shar-Pei rescue dogs for, oh my goodness, probably 5-6 years. They get a regular diet of Dinovite with every meal.
DINOVITE.com.
People remark on what beautiful coats they've got. I tell them, you don't need to wait until a problem presents itself. It's far better to keep the dog happy and healthy at all times.
You won't believe how happy your dog will be.
I get my Dinovite from DINOVITE.com.
Let's Talk Pets on PetLifeRadio.com.
Dr. Berger, such a wonderful topic to talk about, but so common. Thank you for being with us today.
Happy to be here.
All right. So it's interesting because as a kid, I've always wondered, as a kid, I had ear crazy, like so many children. But then as an adult, I had one since. It seems to be not the same thing for dogs. Is that correct?
That's actually quite correct. And in many cases is a misunderstanding for a lot of people, in that when many people are having, if we kind of think of the ear, not to get too technical or too crazy here, but when we're talking usually about ear infections for people, the ear infection is actually in the middle ear. It's behind the eardrum. When we're talking about ear infections for our pets, that ear infection is on the outside of the eardrum, or what we refer to many times as otitis externa, so an outer ear infection. So there are some significant differences, and that also leads to big differences in the way that we treat these problems.
Thank you for talking a little bit about anatomy, because as I explained to people, they just kind of look in the ear, they lift up the ear flap if you have a Labrador or a Cocker Spaniel, and they go, oh, looks pretty good to me, George. And I said, no, we have so much that is different in the way that our ears are constructed, in the way that a dog's ear is constructed. It seems to set them up for these. So give a little anatomy lesson if you would be so kind.
Yeah, I'd be happy to. So when we're talking about a dog or a cat ear, the way I try to explain it to many of my pet parents is that when we're looking down the ear, a dog and cat's ear is shaped more like an L. It's not a straight line. And people, it's much more a straight shot in. Outside to eardrum is just kind of a straight line. With dogs and cats, it's more of an L, and that L creates some problems for us. Many infections can be down in the lower portion of that L that can't be seen from the outside. You need the aid of an otoscope or a viewing device that your veterinarians have to get down into that ear and actually examine the ear. So many times that outer part where you just lift the flap, you might get an unpleasant aroma every now and then, but in many cases that ear can have subtle disease going on down in the lower portion. That's just not going to be evident by just lifting up the flap or looking in the very outer portion of that ear.
And it seems as though, I remember when I was taking dermatology in veterinary school at Davis, and if the question came up on a test, which dog breed likely to have ear infections? If a Cocker Spaniel was on that list, check it, and you always got it right. So why is it that cockers are so prone? And then there's other breeds that seem to be prone to having ear issues.
So when we talk about that, it's kind of a funny statement that you make that comment, because I like to joke a lot of times when I'm talking about ear problems around the United States is when I show a litter of Cocker Spaniel puppies to an average individual, they're like, oh, look how cute all the puppies. And you show that to a veterinarian, they're like, oh my God, the ear problems that may be coming.
Yes.
The reality is that dogs that have a tendency to have predisposition or problems, allergic problems in general, are going to be those breeds that tend to have ear problems. And so when we talk about what are those big breeds that are going to have those tendencies to have underlying allergies, I try to break it down a little bit. I think the Spaniels, I think the Terriers, I think the Retrievers, lovely Labrador and Goldens, and I think of those German Shepherd dogs. And I think that equates to a lot of people the way they feel about what breeds kind of walk into the door. Now, along those lines, there are some breeds that have a tendency, I like to say, for things to go haywire a little bit more quickly than some of those other breeds. And the Cocker is one of those. There's some anatomical and kind of some disease pathogenesis, or the way the disease propagates in the breed, that can create some difficulties quickly within that breed. And so when you have a Cocker who has problems with ear problems, you want to be a little bit more aggressive than sometimes you might have to with some of those Terriers to keep some of the bigger complicating factors down later on in the course of the disease.
So it's a matter of, seems like, a little genetics and maybe a little conformation. So you have the floppy down ears, so it's dark, it's warm, it's moist. It seems like the perfect environment for bacteria and fungus to set up housekeeping.
It definitely is. And, as a dermatologist, when I start to talk about ears, I talk about there's primary problems, those things that actually cause disease. There's predisposing problems, those things that by themselves usually aren't a problem. But when we add on a primary problem like allergies, and then maybe we swim a lot, maybe we have long ear canals like a setter, maybe we have pendulous ears, maybe, I live in, Southern California is not Southern Florida, but maybe I live in a place where the humidity is a little bit higher. And those can be by themselves, humidity, swimming, being a Cocker Spaniel, having floppy ears isn't a problem by itself, but you combine that with an underlying allergy, and now we have some things that start to play together that can create problems for us that we always have to think about when we're starting to think, how am I going to treat this patient differently than the next one?
I think you're exactly right, because I always tell people that ears are just skin stuck inside the body. So if you look at the outside and the outside looks itchy and inflamed and nasty and all these problems are going on, you're probably going to have some ear issues at the same time. So you have to look at the entire pet. And people are always, they come in and say, well, just look at the skin, going, no, I'm going to look at the entire pet, looking at its little nails because problems there, or flipping the ears and looking in there and they go, oh, I didn't know it had an ear issue, going, yep, that's why you pay me the big bucks, guys. That's what I'm looking at.
Yeah, we like to, anytime we get to a pet parent brings us their pet and they're scratching at that head or shaking that head or anywhere up around those ears, even parts of the neck, we want to make sure, we always say we're going to look down those ears to make sure. And I agree with you. It surprises them sometimes when we're like, I didn't even know that they had an ear infection. And many times they can be shocked by that.
And it's not always stinky, but some of the times, like, you can know it has an ear infection even before you flip that ear, because it is a loaf of bread that seems to be just growing in those ears. It has such a yeasty smell, which, rising bread is really a neat smell, but in ears, not so much. Dr. Berger, I have a question for you, and I've always wondered. We see ear problems in dogs, but I rarely see ear issues in kitties. Why? I know they don't swim most of the time, but
there's probably a couple of reasons for this, and not to elaborate and go on too long, but one of the reasons is from a veterinary standpoint, we see fewer cats than we tend to see dogs that are brought to us seeking care. Many times that may be cats are better at hiding their problems, as many cat owners out there can probably attest to, that cats do a great job of masking and hiding and compensating, sometimes more than our canine patients do in terms of showing their owners and letting people know that something's not quite right. Secondly, we don't run into the same allergy issue. And when we talk about, or I should say at the same frequency, when we start talking about the dog population out there, statistics range anywhere from 5 to 15% of dogs have some underlying allergic manifestation. Now, when we talk about cats, those ranges are a little bit broader, but they go way down on the lower end of that spectrum. Along those lines, for a long time, we didn't think cats have as many problems as dogs. But what we're learning and kind of with the passage of time is that, well, some cats might be struggling with ear problems. And cats, it's not uncommon to see a cat have dirty ears. And when we start digging a little bit more, we find out that dirty ear is a yeast issue or a yeast overgrowth issue. And one of the real big reasons for that in cats, again, is an underlying or a manifestation of their underlying allergy. And so, although not at the same occurrence, dermatologists as a whole are starting to recognize yeast ear infections in cats maybe a little bit more frequently than we once did. But I agree, it happens at a less occurrence. And that probably speaks to the level of overall allergy occurrence or or that primary problem, as we spoke to earlier. Just less of an occurrence of those issues in cats compared to their canine counterparts.
Okay, I need you to also be a tiebreaker for me now. When you have a pet that comes in, I think of little poodlettes, and they have these super hairy little ear canals. And it's like, to pluck them, not to pluck them. Groomer doesn't want to pluck them because it's the show look. It's like you don't have a show dog. And here you have a dog who maybe has really hairy ears and no ear infection, or another dog with really hairy ears and a horrible ear infection. So what do you think? Pluck, don't pluck?
I'm a big don't pluck type of guy. And the reason for that really is some of those breeds, as you alluded to, the poodles and some of their crosses or their kind of mixed breeds, they're supposed to have hair in the canal. And I equate it more to, and whether or not it's an appropriate analogy or not, but I like to think of the 40-year-old virgin and Steve Carell, and when he's getting his chest waxed, and realize that plucking that hair is causing that same type of trauma, and that little bit of trauma creates inflammation. That inflammation then sets up a little environment that can become secondarily infected. And we see this actually more frequently than I would like to admit, where when we stop some of these grooming behaviors, a pet who was actually being worked up for allergies, whether it be a food allergy or an environmental allergy, all of a sudden stops having ear problems. And what it comes back to is that source of trauma. That analogy, when I set that analogy in for most people immediately can visualize that scene from that movie.
Oh, yeah.
Bleeding through his teeth.
That hurts.
But you're like, that in essence is what we're doing to the poor ear canal. And that can create some problems. Now, there are certain situations where an ear may need to be plucked. I don't want to get in an all or none conversation, but there are some situations where it can become occluded because of the ear hair and the debris, and it forms a mat that we can't treat the ear. The pet parent can't do what they need to do at home for a successful outcome. But usually we suggest that be done under a decent amount of sedation to make sure the patient is comfortable, and that we take all precautions at that point, and then also treat accordingly afterwards after we've caused that trauma.
So I can see that plucking can be traumatic. Sometimes what I like to do, if they have really furry little ears underneath their ear flap, is to shave the fur on the inside of the flap and right around the bottom. So I feel like it's a little bit lighter, maybe a little bit better airflow. But okay, I will take that into account. Pluck, don't pluck. Yes, 40-year-old virgin. I'll always remember that one.
And I'll go back. You made a perfect point there. Shaving that area, it's just simply cutting the hair. We're not causing trauma to the underlying hair follicle or the skin. And that shaving is a great thing to create air movement for our patients to allow some more movement. But we're not physically removing that hair in a traumatic fashion. But that is a great alternative for those individuals who want to do something at that opening to facilitate it and make it easier. Shaving, very, very much an appropriate thing to do.
Dr. Berger, on that same line you were saying, those really hairy little ear canals can sometimes be hard to clean. I'll have clients come in and, It says raging ear infection. I said, okay, so are you cleaning the ears? Oh, yeah, I'm cleaning them every day. It's like, oh, please, that's part of our issue. So please address how to clean an ear, how often to clean an ear, and what to clean an ear with.
I will try to do my best to address all of those. That's kind of that's a big box to unpack there.
We got a half an hour.
Let's talk a little bit about what to use.
Okay.
And I'm a big fan that when you're seeking a product, this is one of those times where you should really reach out to your veterinarian for advice. And they may have certain products in their office. They may have certain products on an online pharmacy, or they may have another source for you to pick up particular products. There's a lot of different opinions there, but there are ample number of appropriately formulated products that are easily available and commercially available that with your veterinarian's guidance can be easily acquired.
To interrupt for 2 seconds.
Yes.
You're talking about appropriate products. Oftentimes people say they'll use hydrogen peroxide or alcohol to clean the ears. They want us to be cheap. They want to, be cost effective, I should say.
I can appreciate the cost effectiveness, but the problem with many of those substances, as you just kind of brought to the forefront, they can be a little bit caustic. They can be hard on that skin barrier. And again, we're down in that tube, that tunnel of skin, where we're not getting the exposure that the normal skin on the outside that we can see would get. We can create some problems with those products. Now, many of the approved veterinary products are not, I don't like to call them, many of them are not cost prohibitive, but the big difference is they're formulated for the skin of dogs and cats for appropriate use, but they're also formulated to help break down the wax or cerumen to help facilitate its movement up and out of the ear. Many of them may also have an antiseptic for particular, whether it be yeast or bacteria, when we're having recurrent problems that may be advantageous in this particular pet. And so that's, again, where your veterinarian, these are recommendations your veterinarians love to make in terms of making sure that the product we're using is not going to be harmful at the end of the day and is actually doing what we want it to do. Because the last thing we want to do is put all this effort into cleaning the patient's ear to have it all be in vain, where it didn't remove the debris. It didn't get rid of what we wanted it to get rid of, and it actually may have contributed to further problems. The next kind of, I think, part of that was how often should they?
Right.
And I agree. When I hear everyday cleaning, I kind of twinge and get, tight myself thinking about that. And another, I like the analogies. I tried to put the visual aid to this, but I equate kind of the daily cleaning to be equivalent to sitting in a bathtub too long. You start to prune up, your skin gets a little overhydrated, and that same thing can happen in the ear. And that overhydration of the ear and disruption of things in the ear being done too frequently can actually give that bathtub appearance, where we could actually, again, create that environment that may actually be doing the opposite of what we want it to do. So we tend to, at least here, our group here at Iowa State, the 3 dermatologists that are here, we tend to recommend no more than a couple, maybe 3 times tops, depending on what the problem is, a week. We really don't want, pet parents constantly cleaning those ears and potentially causing some problems. The final portion of that is, how do we do it? How do we recommend cleaning ears? And I think everyone has a little bit different take on this, but our sense and kind of the unanimous recommendation here, at least amongst our group, is we want to take that ear cleaner. We want to kind of pull the flap back or open it up a little bit. And we want to flood the ear canal with the solution until it wants to overflow. I then like a little cotton ball at the top, then lightly massage for 30 to 60 seconds, not making sure not to push that cotton ball too far down into the ear, because then we've created another reason to come see us as veterinarians. But we want to make sure.
Normally shake them out anyway.
Yeah,
but yeah.
We want it just kind of there up at the opening. Massage for a good 30 to 60 seconds. Then take that cotton ball and just wipe what you can see. We don't want our pet parents sticking things down into the ear, and then allow the pet to simply shake their head and remove the excess. And then many of these products that we would recommend will usually have some sort of a drying component to them. So they're going to dry out okay with the pet shaking the remainder of the excess liquid out. It also allows us to see how much debris is coming out, which is a great monitoring thing for pet parents to be able to see. Is the debris decreasing with time, which is usually what it should be doing.
A little trick, and I know we're going to have to break right now for a commercial, but one of the tricks that I found is that a couple of years ago, I had an ear infection. Happens to adults too. And the eardrops were the most slimy, horrible sensation in the world as it's going down the canal. It's like, oh. So it's like, oh, no wonder these dogs aren't liking it when we clean their ears. So now what I have clients do is get a big cup of hot water, like they're going to make tea, get the ear cleaner bottle, put it in there until it's baby bottle temperature. Now when you flood the canal, initially the pet goes, and then it realizes, this is the spa treatment. This feels really good, guys. And it seems to make it so much better for these dogs. So that's my little word of wisdom.
It's a great suggestion.
Well, having some great suggestions from Dr. Berger right now. We're going to be taking a short break, coming back, talking more about ears. We'll be right back.
Please have a seat in the waiting room. The doctor will be with you shortly, right after these messages.
For those fortunate to have experienced the deep bond and unconditional love of a companion animal, the death that follows can be one of the most difficult and misunderstood losses to go through. Many times, this devastating loss goes unrecognized and trivialized by family and friends, leaving grieving pet parents struggling to find healthy ways to cope with the loss. In And I Love You Still, a thoughtful guide and remembrance journal for healing the loss of a pet, Dr. Julianne Corbin calls attention to the difficulties unique to the loss of a beloved pet and provides an interactive and compassionate guide to help you process your loss and work towards coming to a place of peace and healing. For those interested in journal therapy and looking for a professionally written and compassionate resource to help understand and reconcile the grief associated with the loss of your pet, this book is for you. And I Love You Still, a thoughtful guide and remembrance journal by Julianne Corbin, is now available for purchase on Amazon and other major book retailers.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Welcome back to the Pet Doctor on Pet Life Radio. The doctor is in, and we'll see you now.
Okay, so Dr. Berger, you mentioned earlier about dogs swimming. I know people, when they swim, get swimmer ear. Dogs seem to get it even more so, or I'll always ask, do you bathe your dog at home? And how do you do it? And those people that are so proud of themselves of putting the dog in the shower and doing it all over, please inform us, enlighten us about swimming and showering with your dog.
So, the question there is swimming okay? And I would say for many dogs, swimming is not going to necessarily be detrimental to them. And there are some big benefits when we're talking about an allergic dog where that pollen is actually settling in on their skin. That essence of the dog jumping into the pool actually is kind of a microbath. It's removing the allergens that may be causing us a little bit of a problem. Now,
Okay.
Can it be overdone? Can they be a diver who's spending too much time under the water where it's the yellow happy lab who actually won't come out of the pool until they're physically removed from the pool. And having lived in Phoenix for a chunk of my life, there were definitely these patients that just overdid it. The random run-of-the-mill, tiny bit of acceptable pool time, is it going to lead to a lot of ear problems? No.
Good.
Is it going to cause some problems if the dog has underlying allergies that aren't managed or dealt with? Potentially, it could contribute to some of those issues. But do we want to, upset that poor dog's life whose one job in life it is, or their one enjoyment in life it is to jump in that pool once a day? No, we definitely don't want to go that far. Now, in terms of showering and bathing, I applaud anyone who has a big enough shower that can accommodate them and their Great Dane and their Great Dane's little buddy, and if we're being careful and minimizing what's going on up there, that is something that can be, the amount of water that may get into the ear is probably going to be minimal. But again, it's going to be a little bit situational. We have to make sure that we aren't just letting the dog sit there. And again, kind of like we talked a little bit with ear cleaners earlier, where it's just sitting there flooding itself constantly, or it keeps diving under the water, or we're not taking a chance to allow those ears to dry out appropriately. Can we do some things? Yes. Is routine recommended things going to specifically cause the problem? No. Again, that minimal water exposure is going to, go back to what is the other underlying problem. As we start these building blocks, When we start adding blocks on top of blocks, that's when we can run into some problems. And I can use my own personal Cavalier as an example of this. I probably should bathe my poor little Cavalier named Leo more frequently than I probably do. I'll be the first veterinarian to say, poor pet parent here, probably should be grooming and bathing my own Cavalier King Charles a little bit more often than I do. But my Leo, my dog, does not get ear infections after a bath. If he had allergies and I wasn't taking some precautions and I was getting too much water in those ears, that's where I'd be a little bit more concerned under those circumstances. And I might take some precautions to prevent them from getting too overly wet.
Okay. So here you are. Thankfully, you have a King Charles without, or a Cavalier without any ear issues. But those people that have a pet and it says, all right, the ears are a little stinky. Maybe they're a little red. Do I really have to go see the vet for this? What's that kind of tipping point where you go, yes, bring your pet in now?
I actually think the scenario that you just pointed out is the time where I would say this is the time to go have that evaluated early on in the process. Is there something there? Is there not something there? I always equate that odor. Sadly, I have to admit, I've written a textbook chapter on body odors in dogs and cats. And it's not what I want to be known for, but that odor is the oils of the skin becoming rancid. And what causes that is usually enzymes from bacteria and yeast. And so once we start to have that odor, getting it checked out specifically with the ears, that's, again, one of those places where your veterinarian may be able to make a recommendation of a cleaner. And that's all, fortunately, the pet needs is just some routine cleaning. We don't need a lot of medications. We don't need a large allergy workup. Just routine maintenance is enough to take care of them. And that's where that early intervention, where something is different or something doesn't seem right, no matter how minor it seems, I think, to me, that's the time that pet parents should really be seeking, is this normal? Is it abnormal? Is there anything we could do now to prevent this from winding up into a much bigger problem? That early intervention, how early can we get them in the door from the standpoint of, can we establish and maintain a sense of normalcy, rather than playing catch up when it gets out of control and is really bad. And your family members, your parents, your neighbors, everyone can see that there's a problem. We want to prevent getting to that late stage before we seek, some early help along the lines.
One of the problems or situations I'll see when clients come in, and I love it when they're being proactive. They come in, they go, Doc, it's probably nothing. And I said, yeah, I'd much rather see that lump when it's teeny and the ears when they're just a little red and the teeth are just a little dirty versus I need to extract 12 teeth and, it's a disaster zone. So there are times, however, you see them, I see them, that the dog comes through the door with a disaster zone of ears. And I tell them that I need to do X, Y, and Z, and they are just aghast. How would you work up that animal that really needs some major care? What can a person look forward to? What can they expect?
In terms of that, what you should expect is that your veterinarian is probably going to say they need to do some early diagnostics. They're probably going to want to do a cytology. They're going to want to see what's there. What is it that I have to treat? And then hopefully the pet parent can anticipate their veterinarian communicating with them. What is there? What other obstacles are there in terms of, is there a lot of swelling in the ear? Is there a lot of exudate? Now, for many owners, a lot of exudate or pus coming out of the ear that can be easy to see. Is the pet painful? Is there a lot of pain? Is there something we're going to need to address there? They should expect some sort of a conversation along those lines in terms of what's present and what needs to be addressed. They should also, to a certain degree, anticipate, or at least I would hope, in the conversations we have with our pet parents, is what can you do? What are you willing to do? Because I need to know what you can and will do, because that's going to help guide therapy a little bit. If you tell me you can't treat Fluffy's ears, well, that's okay. We have some products that are longer acting, that we may choose one of those over some of those products that the pet parent needs to put in on a daily basis. So that they should anticipate a conversation. They should also hopefully anticipate some sort of a roadmap. Where are we today? Where are we going? When are we going to see each other again? What's that milestone or mile marker going to look like? What is it that we're hoping or are we going to try to accomplish by that next step? And then at that next step, what kind of decisions might I be faced with? And then, what's the overall time? How long am I really looking? And again, that's part of the conversation. And I like to think of that conversation as a little bit of a two-way street, because I need to know what people are willing and able to do, rather than, me sending things home and then having, the pet parent have no intention of, I can't do that. That's an open conversation that, needs to be had at that time when decisions are being made. And hopefully it is had for people, because I think that makes the experience for both the veterinarian and the pet parent, it creates a more realistic and open conversation of what can actually be done for their pet. And I think that makes the process a lot easier.
And I think that's when you have a much better outcome. You're exactly right, Dr. Berger, by having that conversation, because otherwise people do get frustrated. This ear problem just never went away. Well, I never saw you back again for the recheck, or those ears are so painful. Well, maybe I'm going to need to sedate your pet this time through so I can really get in there and clean, because me just trying to touch it, your dog is trying to bite you and it really likes you. And now it's here and it's trying to bite me, and I'm trying to clean its ears. So there are times going, I need to either heavily sedate your pet so I can look and clean and get samples. Maybe it's other skin issues like thyroid issues. It can be very frustrating and at times expensive. So what happens if they just say, I can't afford it, doc, or somebody is just really not paying attention? Long-term ear issues that have never been really treated, what problems can it cause?
So those chronic, and we're faced even on a specialty level many times with these same questions, where it boils down to time, commitment, finances. And I hate to say these are sometimes realities of our world, but sadly in some situations they are. But, if we ignore the problem, what can potentially happen? The downside of that can be not so pleasant. We can get chronic stenosis or swelling of the ear, where the whole ear canal eventually becomes swelled shut. The cartilage, or the kind of the squishiness of the ear, actually can become mineralized and more like bone. We can get abscesses. Those abscesses may drain out somewhere other than the ear. They're rupturing and draining elsewhere. We might end up with some middle ear problems. And so there's three components to that ear. There's the outer part, there's the middle part, and then there's the inner part inside your skull. But that middle part can also become abscessed and may also create a lot of pain, realizing that the jaw articulates in that general region. So every time the pet may be taking some food, there could be some discomfort with that. But it can also eat away at the bone. That infection over time might eat away at the bone. And we can see where this goes. But ear issues left untreated in a severe state can lead to a lot of other problems. And it's important to realize that not only are there important bony structures in these regions, there's also important nerves. And we can, when that middle ear gets inflamed and angry, we may get, some facial nerve issues. I kind of equate that to Bell's palsy for people. There might be a facial droop or something they can relate to, or what we call the vestibular cochlear nerve. Think of your sense of balance or vertigo. A pet may get a horrible sense of, a sensation of vertigo because that nerve is being irritated. And so those are some of the things that can really go wrong when things are either ignored or left untreated.
I believe that I remember in veterinary school, and I honestly don't think I have ever seen it, where an ear infection could, in theory, lead to a brain infection as it gets into that inner ear. Is that correct?
That is actually, it is correct that actual sequence of events can happen. And I would like to say that on a referral basis, or as a specialist where I see some of the worst cases, we'll run into that. It happens rare, thankfully. This is not something we see very common or routinely, but we do see rare circumstances where that bone has been eaten away, where now there's a connection from the ear to kind of the inside of the skull where the brain sets. And as you can imagine, that's not a good place to be.
One of the options that I will sometimes, and thankfully, most of my clients have been able to, get on top of it. We'll really have that heart to heart. This is the fourth ear infection of the year. Okay, what can we do differently? Maybe you're not understanding what needs to be done. Let's go through this again. I found one situation where I could not get this ear infection cleared up on this dog. The owners were being so good. We were trying everything. They were doing it. It's like, okay, let's regroup. What's going on? Okay, how are you cleaning that? Oh, yeah, and the other dog is helping to clean its ears too. Really? Tell me what's going on. So the other family dog was constantly licking this dog's ears. So as soon as I started putting licking deterrent on the inside of the ears, and crazy thing that I use, not toxic, tastes lousy, most dogs don't like it, is solid underarm antiperspirant because it sticks to the fur. So we put it on the inside of the ears. The other dog said, "Oh, kid, you taste bad," and left the ears alone, and the ears cleared up. It's like, woohoo! Bizarre.
Yeah, no, and I think that goes back to the earlier conversation we were just having a few minutes ago, which is that open communication. I can't stress that enough in terms of just having a conversation, making sure the problem, all of the components, that honesty, that frank, honest conversation of this is what's happening, this is what's going on. I like to kind of think of our exam rooms as a judgment-free zone. The more honest conversation we can have, I really feel from a veterinarian to a pet-parent relationship, the more honest and open that relationship can be, the faster we can get to an acceptable resolution, and the quicker it is, and the happier everyone is in the end.
And just kind of as an aside, going back to that long-term sequelae, what can happen, tell people what an ear ablation is, why it's sometimes necessary, and sometimes why it is just a fabulous gift to a pet.
So, what we refer to kind of this ear ablation, or what we like to call a total ear canal ablation, from a cosmetic standpoint, what's happening is that L-shaped tube that we talked about earlier is physically cut out and removed. Now, cosmetically, the ear flap is there, and for many owners, they wouldn't know that the ear canal itself was removed unless you go to lift up the ear flap and realize there's no opening. But the reason it ends up having to be done many times is, as we talked about, in those chronic cases that aren't managed early on or aren't prevented, that ear canal can mineralize and form a solid rock. And under those circumstances, there's been changes to the ear canal anatomy that we can't overcome, and that will never get opened back up, and we'll never be able to stop medicating. And what can happen is we get to a point where the best solution for the pet, and it's not giving up, it's not the end of the road, but many times people will describe it as getting their dog back, or their dog becomes a puppy again, because that source of pain, if you think of that abscess, that chronic source of inflammation, it's gone away. It's magically gone away. Now, again, we like to think of that as kind of an end resort procedure for when the ear is at a state that we can no longer help it medically. That's kind of the end of the road and a procedure that can be done. But our goal, yours and mine, is to try and prevent that from ever becoming a reality. But in those cases where it's needed, it can actually give a sense of renewed well-being to the pet. And in many cases, some pet parents wish they would have come to that conclusion sooner because of how kind of barbaric the surgical procedure may sound. But it's a procedure, it's out there, and there are circumstances when your veterinarian starts to talk to you about it. We've usually run up against some hurdles that are not going to be overcome and not going to provide you that sense of relief or being done with the problem.
All right, very briefly, Dr. Berger, because I know we can just keep going. This has been a great conversation. I really appreciate it. What are your top 3 words of wisdom for pet owners who are listening right now? Dogs have had ear infections, or they don't want them to get ear infections.
Top 3 pieces of advice. See your veterinarian, have that conversation with them, and when your pet starts having ear problems, don't be afraid to ask your veterinarian why. How do I prevent this after they start to become an issue?
Great words of wisdom. My guest, fabulous, Dr. Darren Berger. He is a board-certified veterinary dermatologist and Associate Professor of Dermatology at Iowa State University's College of Veterinary Medicine, Ames, Iowa. Dr. Berger, this was wonderful. Thank you so much.
Thank you. I had a pleasure. This was fun.
This is Dr. Bernadine Cruz. You've been listening to The Pet Doctor on Pet Life Radio. Please tune in again next week. We'll give you more information on how to make you that best possible pet owner. Take care.
Pets can be a wonderful addition to your life because they're a member of the family. Keeping them healthy and happy is important. Pet Life Radio presents The Pet Doctor with veterinary media consultant and veterinarian Dr. Bernadine Cruz. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets. The Pet Doctor, on demand every week, only on PetLifeRadio.com.